Hi, I just wanted to put a video together with regards to a really common question that I get asked pretty much all the time when anybody's looking to get a hair transplant. And it's not what are the results going to look like, it's not how painful the surgery is, it's not how long does the surgery take. More often than not, it's how long is it going to be before I can look normal? How long is it going to be that I can then return back to work? And this is one of the most incredibly kind of popular questions because people that I meet with have selected the surgeon that they want to have surgery with. They've done their research. They know the surgical process. They know what's entailed. They know how much it's going to cost. They know how long the results are going to take until they get the end result. But what they tend to fear most, and is the biggest deterrent, is how long is it going to take them to look normal again after surgery? Because nobody really wants anybody else to know that they've had surgery, not in the short term anyway. So it's quite interesting that this question gets asked so regularly, and what I wanted to do is just put a video together, try and give some basic guidelines as to post-op healing, the downtime that is involved with having a hair transplant. Now, generally speaking, you could have surgery tomorrow and you would have any area that's worked on shaved down. Generally, this is to protect the integrity of the hair, the native hair that is residing on top where any hair transplantation is performed in the recipient area. And what you'll find is after that surgery, there's going to be an immediate post-op appearance where it's very red, all the grafts are going to be protruding out of the scalp, and it can take approximately 10 days to 2 weeks for that redness to subside. And then what happens then is the follicular units are embedded in the scalp, and the hair shafts that are superficial to all intents and purposes, they shed around the 2-week post-op period. So then you're in a situation whereby what we call the ugly duckling phase, where you've ventured into surgery, you've had your existing situation shaved down, you've got lingering redness, and it's pretty evident that you've had surgery. Obviously, it all depends on your own situation, your own circumstances, because if your hair loss is minimal and you're only working on the hairline, then obviously you can use your existing native hair to comb over. If I had my whole hairline done, I could comb the hair forward and cover it all over. But if I'm completely thin in the frontal third, and this whole area is going to be shaved down and the recipient area is going to be worked on in here, then obviously I'm going to have a crazy comb over to cover it over. So predominantly I'm discussing people that are having surgery in this kind of area or more extensive, that haven't got a great deal of hair to be able to cover the recipient area. Now, with regards to that timeline of how long is it going to take before I can go back to work or before anybody's going to know I've had surgery, realistically speaking, it can take in the region of 4 to 6 to 8 weeks so that all the healing has calmed down. You can then have the appearance whereby you were pretty much a pre-op situation. So basically days imminent to surgery before you were shaved down. It's going to take 6 to 8 weeks as a guide to get your hair back to around an inch or maybe an inch and a half regrowth of that hair that was shaved down. Because hair grows on average about half an inch every 3 to 4 weeks. You can take supplements, MSM. If you Google it or use my website, spexhair.com, you'll be able to find information on that. You can take biotin to help speed up the growth or the health of the hair. You can apply minoxidil to that area to help stimulate blood supply, but I would advise not doing that until 2 weeks post-op, allow all the healing to take place. But realistically speaking, you are going to have to attribute a significant amount of downtime to the surgical kind of procedure in order to get away with it. And this is difficult, and a lot of patients I meet, high profile patients, even patients in day-to-day life that work 9 to 5, find it very, very difficult to accrue enough kind of holiday period to enable them to have a period away from their day-to-day life whereby they can get away with having been outed that they've had some form of procedure or something has happened on their head. So it is very difficult. What I'm intending to do is make some further videos to help guide you with regards to tips of how you can get around this, or at least kind of aid you in getting back to your day-to-day life as soon as possible, with little tricks of the trade, so to speak. I mean, I've had over 10 procedures myself. I know what it's like. I know the emotional involvement, the huge leap of faith that is involved with having this procedure anyway. Never mind the repercussions of having the surgery in the short term. It can be very difficult. So hopefully I can guide you with regards to new videos, and if you just look out for them on my website, they'll be coming shortly. Okay, take care.